Welcome to Putting You and Me in Consumer Healthcare, focusing on healthcare delivery, health and wellness, and healthcare IT. You'll hear from 35 incredible startups using blockchain technology to enable better access to quality of care for marginalized communities, improving patient-provider experience, addressing chronic pain, and creating innovative technologies focused on improving patient experiences, simplifying remote patient monitoring, and more. If you're interested in meeting with any of these founders, we will be sharing their contact information after their pitch. It will also be available in the Airtable linked in the description below this video. As a reminder, throughout each session, you'll have the opportunity to rate startup pitches on a scale of 1 to 10, with 10 being the highest. These votes will be tallied to select our top 5 finalists for our $25,000 Community Choice Award, which will be announced at MassChallenge Awards in February. For immediate questions, use the chat function on the right-hand side of your screen or contact our help desk at earlystage@masschallenge.org. Let's hear from our first founder.
Did you ever wonder why prescribed controlled substances like opioids are dispensed the same way as Tylenol, using 1960s technology, despite a 7% chance of becoming dependent and risking an overdose? I did, which is why I left Wall Street to work full-time on combating the opioid epidemic, which recently surpassed 80,000 annual deaths and an annual cost to society of $1 trillion. Adinex has developed a patented, low-cost system to control and monitor usage, educate patients, and dispose of excess pills. Our system can also be used to collect data to personalize treatment and reduce rampant overprescribing to the tune of 3.3 billion pills a year. Since applying for the MassChallenge program, our study results with Columbia University Medical Center were published in a peer-reviewed journal. We started a phase 2 study with Columbia. We were named a world-changing idea by Fast Company magazine, and the CDC recently awarded Adinex a $259,000 SBIR grant to work with Yale School of Medicine on addiction treatment. We're now seeking $2 million to launch our product in the market. If you're an investor or want to partner with us, give me a call. Thank you.
One-third of hospitalized patients face communication barriers, such as intubation, language barriers, and hearing impairments. And not being able to communicate effectively with their providers makes them 3 times more likely to experience preventable complications, most of which are not covered by payers, costing hospitals $6 billion per year in unpaid claims, quality of care penalties, and malpractice cases. Outcome is a communication tool that enables efficient patient-provider communication at the point of care to reduce preventable complications and improve providers' efficiency. We use AI to help providers get the critical information they need from their patients 10 times faster than current methods, so that they can diagnose their patients effectively and identify potential complications before it's too late. Reach out if you want to join our mission to overcome communication barriers and ensure safety and quality of care for all patients.
Hi, my name is Peter Kallestrup. I am a co-founder and the CEO of iFunction. As many of us know from family or friends, Alzheimer's disease is a devastating condition. Unfortunately, there is no cure available yet, so until that changes, it becomes critical to be able to identify individuals who are likely to develop Alzheimer's as early as possible, while we still, potentially, can slow down or manage the process. Now, iFunction is contributing to this effort in 2 ways. 1, by providing a computerized cognitive assessment, we can differentiate between older adults who are cognitively normal from those with pre-mild cognitive impairment, a possible precursor to Alzheimer's, and can do it more effectively than other traditional neuropsychological tests and for a fraction of the cost of PET scans or blood-based biomarkers. And 2, by providing a functional skills assessment and training software tool which can help build or restore the everyday for individuals with cognitive impairments, including mild cognitive impairment. Thank you.
Adhenia is Swahili for consent or approval. In clinical research, it is a driving force for new drug discovery and approvals.
We are a community-led research data collection platform that captures the health-related voice, sentiments, and attitudes of Black, Brown, and Indigenous people of color for health research.
We all know, due to past transgressions, that trust is the biggest issue here. That's why you can't work in this community unless you're in the community.
Just imagine what our world will look like if BIPOC communities in the healthcare industry are partners in increasing the participation in genetic diversity of phenotypic data in clinical research.
Let us show you how we get everyone an equitable seat at the table and everyone's voices heard.
We'd like to thank MassChallenge for the access to mentorship, resources, and insights we've been able to extract from the program, as well as the clarity in our overall business that we've attained.
Thank you.
KimboCare is a digital health startup that offers the ability to purchase health credit, which is send money, to help patients in need gain access to quality healthcare in developing regions, starting with Africa. Now, many of us here in the room have supported Ukrainians over the past few months with a variety of issues, including health. But do you know how much impact your help has truly had? Well, me neither. And that is the problem that KimboCare addresses. We provide our clients with the infrastructure, the local infrastructure, and the transparency that they need to deploy outcome-based healthcare interventions that would eventually help drive resilient communities. If you're a bold investor, passionate about transforming healthcare worldwide, then you are to meet KimboCare. Thank you.
Black women doctors are underrepresented at higher ranks of leadership in medicine and healthcare. They make up just 7% of women physicians and 5% of women medical school faculty. Only 3% of board members at healthcare organizations are Black women, and there are no Black women CEO board chairs. We need our physician workforce and healthcare leadership to reflect the diversity of the communities that they serve. Viva Docs is a 501c3 nonprofit organization that prepares Black women for senior positions in medicine and healthcare. We provide professional development programming, leadership trainings, one-on-one coaching, and member partner mentorships and sponsorships. Our mission is to help Black women doctors advance to the highest levels of medicine and healthcare, not only to improve health access and outcomes for the Black population, but also to diversify the healthcare leadership and governance.
Did you know that there are 32 million individuals that suffer from food allergies, costing the healthcare system $25 billion? And these individuals are fearful of something that you and I take for granted every single day, like eating a meal, traveling, going to social gatherings. And this is why I built Allergen IQ. Allergen IQ is a comprehensive virtual allergy care platform initially focusing on food allergies to improve healthcare outcomes and to provide access for competent allergy care. If you want to learn more, email me at allergeniq@allergeniq.com.
Let me share a story about Jenny. Jenny became depressed in her new job, but her therapist ignored the role her Asian values played. Ultimately, her fear of losing face drove her to the edge. I'm Alice, CEO of Anise Health, and I lost Jenny, my close friend, to suicide. Like Jenny, the 130 million people of color, or POCs, are 50% more likely to drop out of therapy prematurely, which has a huge impact, costing employers $15,000 per employee annually. Enter Anise Health, the gold standard of mental health care for POCs. We provide culturally adapted online therapy, coaching, and digital content, which have been shown to be 5 times more effective. In our MVP, we saw 30% improvements in symptoms after just 4 weeks. We're growing 33% week over week in paying clients, with early feedback indicating high stickiness and satisfaction. We've closed our pre-seed round and welcome connections with potential B2B pilot partners and seed investors. We hope you will join us to empower everyone to live an authentic and flourishing life.
Autonomio has decided to fight long-term disability in stroke survivors by drastically improve the standard of care. Can you imagine that today 1 in 4 people will be hit by a stroke and 40% of them will never be independent again? We're providing a home rehabilitation, exercise, and gaming platform approved by therapists. Cherry on top, we combine it with a cutting-edge exoskeleton to support walking and many other functional exercises. Autonomio is your personal trainer at home, accessible 24/7 and backed up by therapists. It will get you back on your feet in a few months, thanks to intensive and fun rehabilitation. To prepare our second clinical trial, we're currently raising $1.5 million. Looking forward to hear from you.
Hi, everyone. My name is Dr. John Su, CEO and co-founder of iPill Dispenser. I practiced anesthesia and chronic pain management for 29 years, but was never really able to accurately monitor opioid use by my patients at home. I was really worried about opioid misuse, diversion, and overdose by my patients. One night, I couldn't get money from a bank ATM to get my dinner. I had to use my mobile app to figure out what the problem was, and I had an aha moment. I could use my mobile app to control dispensing, a dispenser for secure storage, and I could destroy unused pills to reduce diversion, just like a banking app and a bank ATM. Fast forward 3 years, we have 3 patents, FDA Class 1 registration, FDA Breakthrough Designation. We have VC funding. We have product market fit and paying customers. We're looking for people to join our team. Thank you very much.
Taki is a virtual receptionist for healthcare providers like hospitals and clinics. Taki is an intelligent, HIPAA-compliant virtual medical assistant that provides patients with human-like conversational experience over phone. We deliver 24/7, always available access to appointment management, prescription refills, key treatment information, and other typical patient service processes. We help healthcare providers with increasing costs of running a reception, and we help them grow their patient base with proactive reminders and lead generation campaigns. Our customers typically experience over 60% cost optimization of patient reception processes.
Hi, I'm Bianca, and I am the CEO and founder of AmpleWorks. We are the future of inventory management in healthcare. I've been a nurse practitioner and software engineer throughout my career, working at companies like Kaiser Permanente, Stanford Hospital, Apple, and Datadog. And in my clinical practice, inventory for patients always goes missing and delays care and even endangers patients' lives in surgery. Our founding team is a group of doctors, nurses, and engineers who have had similar experiences in healthcare, and we were all passionate about solving this problem and doing something about it. In fact, this is a huge problem. 1 in 10 surgeries are delayed every day due to missing inventory. And hospitals are spending over $10 million annually due to inventory being missing, not being replenished, or spoiling. And this is because hospitals are using the most outdated technology today, such as paper notes, spreadsheets, legacy software that just doesn't have real-time data, and hand counting inventory one by one, which can cost thousands and thousands of dollars of labor hours. So it's an exciting time to be involved in this problem because inventory management market is growing at 21 billion spend and growing at 18% year over year. So it's a really exciting time to be involved in this inventory market. To solve this problem, we created a smart camera that uses real-time image recognition AI to track inventory on shelves. You can track all your inventory levels all on the same dashboard and in a single pane of glass for end-to-end inventory observability, tracking, and alerts to monitor inventory that is running low. We've launched our technology in hospitals, clinics, surgery centers, and medical device companies and have an ARR of $240K with a $10 million pipeline, which is growing 15% month over month. And our projected ARR for the year 2022 is $2 million, and our technology is to go into different customer segments like distributors, pharmacies, and partners in next year's Q2. Our projected ARR continues to grow, and we spread our technology to different customer segments like distributors, pharmacies, and other partners. Our passive inventory technology has been awarded and offers a very low-cost option for our healthcare partners compared to other competitors, and it is also more accurate. Overall, the AmpleWorks team has had a really strong run. We've developed a strong and passionate team of doctors, nurses, and engineers. We've had incredible traction onboarding a large network of customers, creating a network effects between our customers, and creating thousands of proprietary data sets where our customers can share their data. So if you're excited about helping doctors and nurses have the tools and supplies they need to take care of patients, contact us today at AmpleWorks.
Binary Bridge brings health equity and access across emerging economies while filling an unmet market need in health technology. Half of the world's population lacks access to basic healthcare, primarily due to a lack of healthcare professionals and a lack of access to the internet and innovative technology solutions. So we created Backpack EMR. It's a portable electronic medical record system that can capture and share data offline without the internet or electricity. So our custom-built offline data sharing network allows clinics to continue operations if the internet or power goes out, or to run pop-up clinics in remote locations. Then the data is backed up to a cloud server when the internet is available. We have 30 organizations using Backpack EMR across 24 countries, and now we're building up our clinic operations features and partner integrations to provide a full clinic management solution for health centers. So we can provide medical supply stock management, personal health records, telespecialists, and AI-enabled diagnostic tools.
Hi, I'm Berin Serdar. My pronouns are she, her, and I am the co-founder of Cloud Privacy Labs. At Cloud Privacy Labs, we help machines understand each other, even if they speak different languages. Consider a doctor telling to her patient to seek behavioral therapy or to follow a certain diet without knowing if the patient lives in a safe environment or even has access to food. This type of critical information is usually stored somewhere, but many times it's not shared, either for privacy concerns or because it's in a different form. Our goal is to help share such information, make sense of it, while also respecting the privacy of the individual. We have two products. Consent Grid integrates granular user consent into data exchange and filters data. Layered schema architecture helps combine, harmonize, and make sense of information that's coming from either different sources or different domains. We are currently working on the semantic harmonization of health data as part of our ONC-funded LEAP project. Our products are domain agnostic and have multiple potential use cases. Please contact us to learn more. Thank you.
Here at EtherMed, we are solving a root cause bottleneck problem in US healthcare called prior authorizations. It is this tiny little paperwork problem that sits at the intersection of nearly every single interaction in US healthcare, happens to be a $300 billion market opportunity, and causes massive, massive problems. Provider burnout, huge amounts of wasted labor, hundreds of millions of dollars per hospital spent on authorizations itself, along with massive numbers of patient impacts, delays, deaths, and more. This labor problem is also a huge issue in reverse for both payers and providers. We solve it by bringing our algorithms in to train over their existing data sets and workflows, and in a way that's entirely back-end to fill out these paperwork issues for them without any hands-on. We have an amazing team of clinicians, physicians, along with statisticians, amazing world-class machine learning engineers. We've secured our first contracts with an average annual contract value around $4 to $5 million a year, and we are building. We are looking for additional early adopter partners to help build out additional case studies, investors, collaborators, teammates, all the above. Come join.
Me again, just checking in. Are you feeling motivated, inspired, moved? Let us know in that chat or score the startups you've seen so far for the Community Choice Award. You can also tweet us at MassChallenge on Twitter and share your favorite part of this experience so far. Feel free to pause the video at any point, stretch your legs, check the Airtable to schedule time with founders, or keep powering through to hear more inspiring startups.
Friendalytics is a patented web app that personalizes the learning process for the over 160 million patients and students worldwide who have a cognitive deficit, such as stroke, dementia, TBI, autism, and Down syndrome. Our story goes way back to when I was 12 years old. My grandmother suffered a severe stroke while undergoing open heart surgery, and to help her relearn fundamental concepts, I created a multiple choice game for her using PowerPoint. Current solutions are expensive, antiquated, and generic, and we're flipping cognitive therapy and digital learning on its head. Our fun and engaging learning sessions have media, sound effects, and a built-in scoring system that helps caregivers easily identify areas of progress. Since joining MassChallenge, we've completely changed our business model within education by launching a freemium option for our teachers. Today, Friendalytics is used by hundreds of clinicians and teachers across 28 states and 3 countries. We're on a mission to help the world's largest minority, people with disabilities, lead more meaningful and independent lives. We'd love for you to join us. Cheers!
Years ago, I received a phone call from my grandmother telling me that a nurse almost killed my grandpa by making an identification error. Like my grandpa, millions of patients are suffering from identification errors every year. This is mainly happening because of the ID bracelets and ID cards. That's why in Heuristic we help health entities with patient identification and management using fingerprint technology. The MassChallenge has helped us a lot enter the US market by introducing us to regulation experts, health entities, and VCs. So please, if you have an expertise in one of those areas, drop us a message. To conclude with my video, we always give 2 options. You can help us reduce those statistics, or you can run the risk of being part of those.
LabFront is a digital biomarker company working to usher in the new age of health research. With the exponential growth in IoT and wearable devices, it is now easier than ever to remotely collect massive amounts of physiological data, everything from heart rate to brain waves. However, analyzing such an overwhelming amount of complex data is a technically challenging and time-consuming process. Utilizing our years of experience running Harvard's Center for Dynamical Biomarkers, we launched LabFront, a data collection and analysis platform that collects raw data and turns it into digital biomarkers. This has unlocked possibilities of remote data collection and decentralized clinical trials on a massive scale. And since launching in 2021, we've been able to break into the market, securing paying customers from top US universities, including Harvard, Stanford, MIT, and more. And now, thanks to MassChallenges, we've started to expand our partnerships to include large corporates, including life science companies and CROs. So, if your organization runs research, reach out and learn why we are researchers' favorite new tool.
Hi, I'm Won-Suk at Medii Plus in South Korea. I just tested positive for COVID-19 today. Once a scary disease, I don't have to worry too much about it anymore. This is all because of rapid drug development. We want to make this possible for everyone suffering from diseases all over the world by digitally transforming and thus revolutionizing preclinical trial stage. It takes several months just to find the right clinical trial partner to launch a clinical trial. With our very own FICRO, however, it takes just days. All you need is to follow 4 simple steps. Sign in, search for clinical trial partner with the expertise you need, browse through curated information, and contact the partner of your choice. FICRO will accelerate drug development process drastically, allowing more people to be free from the fears of diseases like me. This was Won-Suk at Medii Plus. Thank you.
I'm Romy Antoine, founder of One Stop Wellness, a health literacy platform that pays employees to create healthy habits. I understand the importance of health literacy. My mom, who had stage 4 cancer, was excited that the doctor gave her a nurse, only to find out she was on hospice. This lack of health literacy is a big reason why wellness programs only have 28% engagement. Ours gets 70%. Our app lets employees do health assessments, track activities, and upload their blood work. They get a report to share with their doctor and a wellness plan with on-demand videos and fitness, nutrition, mental health, and medicine. Just like Netflix recommends movies based upon your preferences, we recommend videos based upon your health data. We help companies reduce their insurance costs while helping employees keep more of their paycheck. There's over 42,000 companies in our market, and last year we had over 106 users, and now we have 17,000. Recently, we got investment by Amazon to create voice skills to enhance our capabilities. Our goal is to raise $500,000 and partner with health insurance carriers to improve access to the healthcare data.
Opt is a B2B SaaS digital mental health platform targeted at healthcare organizations. We are creating a new category of mental health tools that applies machine learning and AI to dramatically lower the cost of mental health treatment and increase care capacity. We apply natural language processing and proprietary AI algorithms to capture data that provide accurate and actionable insights about patients' condition, allow for objective and data-driven decisions about courses of treatment which fits each individual patient's needs, and a streamlined delivery of care through our clinically validated treatment plans. Through serving over 3,000 patients, we have reduced symptoms by 25 to 45%, lowered the cost of care by up to 10 times, and increased clinician efficiency by 3 to 4 times, and achieved more than $1 million in revenue since 2021.
Hi, I'm Katie. I'm an autoimmune patient and founder of Pictal Health. And I can tell you it's painful for people with chronic health conditions to tell our stories. We repeat ourselves over and over, but often don't feel heard or seen. And it's hard for our providers to absorb our complex stories. This all contributes to 12 million diagnostic errors and billions of dollars wasted every year in our country. Pictal Health helps patients curate and tell their stories visually. We combine traditional health data with life events, symptom history, non-medical treatments, and more to create a holistic, interactive visual health timeline. After piloting with 62 complex patients, 87% said their provider understood and listened better, and providers have reported improved communication and efficiency. So at Pictal Health, we're helping patients be heard and seen while helping providers make the best informed decisions, all while reducing errors and unnecessary spending. And we'd love to hear from you.
Roxy Health is catching patients before they fall. At Roxy Health, we've built a senior-friendly digital engagement tool that takes in patient-generated data to identify declines for patients in the community. We then turn this into timely, targeted action items for health plans to prevent falls. So we know that seniors are not tech-savvy. We do this without requiring patients to download a native app or enter a username or password. We sell our product to Medicare Advantage plans and accountable care organizations. For some of these plans, we can actually double their gross profits just by preventing a small percentage of their falls. But that's not where it ends. We're building the infrastructure to pair patient-generated data with clinically driven AI from years of experience in population health on our team. By pairing these two together, we finally have the opportunity to bring healthcare predictive analytics into real time. Thank you.
My name is Dr. Aldo Maspons, pediatric gastroenterologist, CEO, and co-founder of VemiDoc. And during my training at large county health systems, I witnessed and studied the large number of patients that went through the hospital and got hospitalized or went to the ER unnecessarily because they were non-adherent to the doctor's care plan and or because they were unable to get a hold of their doctors. Most of these patients were Latinos. Emergency room visits and hospitalizations are two of the most expensive portions of healthcare, and they're preventable if patients can stick to the care plan, to be adherent to it, and get a hold of their doctors, which is why we created VemiDoc. We're a bilingual mobile health app, and our customers are Medicaid care organization insurances. We help them save money by preventing unnecessary hospitalizations and unnecessary ER visits. We help the doctors decrease their cognitive load, and we help patients improve their quality of life by avoiding hospitalizations. VemiDoc, mantente conectado, mantente saludable. Stay connected, stay healthy. VemiDoc. Thank you.
CertAlert, we have a very unique solution to the problem of medication adherence. It's our wearable pendant. The pendant can be designed to look however the user would like it to. It can have any photo, insignia, logo. But the way it really works is when the pendant alarms to let you know it's the right time to take your medicine, the user will find they cannot turn the alarm off independently. The only thing that turns the alarm off is this small sensor that's located under the pill bottle's cap. To turn the alarm off, all you have to do is swipe it across the pendant. It's very simple, but as an end result, your open medication container will be in your hands every day at the right time. We have a color-coded system so that medications don't get mixed up, and it eliminates the need for reading. Everything with this product is so simple. We're a Class 1 medical device, so we don't have to go through the regulatory processes, and we have a patent for this product. But there's so much more that this device does, and we would love to talk to you more about it. Hey, if you like it, get in contact with us. Thanks.
Hi, I'm Amanda Schnetzer, co-founder of First Then and mom of a 13-year-old boy with attention deficit hyperactivity disorder. ADHD affects more children in the United States than any other pediatric mental health condition. Less than a third of these kiddos are receiving quality care. It's relatively easy to access ADHD medication. What's really hard for families is the time, effort, and cost involved in accessing essential behavioral treatments and support and sticking with it. At First Then, we're bridging this enormous gap with a family-centered self-care platform that delivers science-based training, data-driven practice tools, and resources for caregiver well-being. In MassChallenge, we've made enormous progress and gained momentum, validating our customer, honing our business model, partnering with a clinical practice group, and raising 60% of our angel pre-seed round. Families, payers, and providers all stand to gain from First Then's innovation. If you'd like to become a part of it and learn more, please contact me.
Imagine spending 6 to 8 hours a day on a routine that was absolutely necessary for the health and well-being of your child. You'd probably want to optimize that time to ensure for maximum development of their physical, emotional, and mental well-being. That's why we're two moms who created Griot, because we believe that infant feedings can be less stressful and about much more than milk. We invented a baby bottle system that's designed to promote brain growth while deepening emotional connections. When we first started MassChallenge, we were at the tail end of manufacturing and trying to figure out what our product launch would look like. The best part about the last 3 months is that we were connected with mentors who helped us develop a robust yet lean sales and marketing strategy to guide our product launch. Reach out to us to learn how we're building a baby-obsessed community of professionals and parents that are ready to introduce our baby bottles to the next generation of first-time moms.
When I was 16, I was really shy and insular. I decided to quit school to go and work on a farm just to avoid social situations altogether. I had social anxiety, which is one of many anxiety disorders that requires treatment in order to overcome it. But 80% of people around the world that have an anxiety disorder like I had don't get treatment because going to your psychologist and doing exposure therapy is too expensive for many people, hard to access due to location, there's a stigma, and there are a lack of trained psychologists right now. Overcome is a smartphone app that, together with a headset, provides virtual reality exposure therapy using someone's smartphone. It's safe, data-driven, convenient, affordable, and built by a world-class team of clinical psychologists and engineers. Our recent clinical trial with the University of Otago shows that on average, there's a 75% reduction in someone's severity after 6 weeks of treatment with Overcome, and at 1/28th the cost of traditional treatment. We've just signed our first channel partner with Air New Zealand for Fear of Flying. We've just received investment from New Zealand's largest mental health telehealth platform, and now we're ready to scale. Thank you.
The opioid epidemic today is still unsolved. We were all sold a lie for decades that there was a magic pill that will cure our pain. If that was true, we wouldn't today still have 67 million Americans suffering with chronic pain. Yet there are decades of research proving that a mind-body approach to chronic pain is the most effective approach. Well, at Pain Navigator, we're finally making that pain management approach accessible to all. Pain Navigator is a digital holistic program for Americans suffering with chronic pain. We use cutting-edge technology and a proprietary algorithm to help patients manage their chronic pain. Think of us as Livongo for chronic pain. We've completed our first clinical trial with incredible results, proving our ability to reduce pain and reduce anxiety and depression. And through MassChallenge, we've developed a strong commercialization plan and are ready to scale. So reach out to me to be part of our pre-seed round or to pilot our program at your health system or health plan.
Greetings, MassChallenge. Daryl Davis, co-founder, CEO of Rockridge Mobile Health. Thank you for the opportunity. We built our company to increase access and outcomes in oral health. We recently completed the Dentalthon pilot in Oakland and saw a 63% literacy gain over the 30-day program. Based on user feedback, we created a new user-facing website, dentalthon.io, and have recently gained another pilot that we're going to run for 10th and 11th graders here in Oakland this fall. The other thread that we found is access to a payer through the tobacco tax that every state has. And we feel like we can now scale our program to improve access and outcomes in not just oral health, but overall health as well. Daryl Davis, Rockridge Mobile Health.
I'm Shireen Abdullah with Yumlish. Poor nutrition is the #1 cause of illness in the United States and is responsible for over 500,000 deaths per year. Go to the App Store today and browse through weight management and disease management apps, and you'll soon realize that they're largely used by white, wealthy, educated individuals. That's where we came in. At Yumlish, we're creating a nutritional health platform that connects dietitians and patients. Through our programs delivered entirely over web and text, we see weight loss, a reduction in A1Cs, which is a primary measure for diabetes, and more importantly, we create 12.5 virtual touch points per person per week. Now, we are revenue generating with contracts with the American Diabetes Association, the United States Air Force, and we have secured SBIR funds from the CDC, NIH, National Institute on Disabilities, and even the DoD, with options for additional follow-on funding totaling $3 million. We are raising our current seed round focused on market expansion, product development, and beefing up our upcoming studies. Competent nutrition education is needed, and it needs to be scaled in a way that bridges our food choices with better health. Join us.
Thank you for joining Putting You and Me in Consumer Healthcare. If you haven't already, input your scores for our Community Choice Award. Reach out to the founders you wish to connect with and check the rest of the agenda for more awesome startup pitches.